So the approved BTKs for CLL currently include ibrutinib, acalabrutinib, and zanubrutinib, and they're all covalent. And so in general, we don't think of sequencing them. The one setting in which one might be able to sequence them is if a person stops ibrutinib for toxicity or even acalabrutinib for toxicity, then it could be reasonable to subsequently try one of the other covalent inhibitors. We do have clinical trials showing that in patients who are intolerant to ibrutinib, they could tolerate acalabrutinib, and in patients intolerant to ibrutinib and acalabrutinib, they could tolerate zanubrutinib. But it's just important to be careful that the patient didn't progress on their first covalent inhibitor, because in general, if they've progressed on one, then they're going to be resistant to the others. We don't yet have a CLL approval for a non-covalent inhibitor. When we do get that, likely for Pirtobrutinib first, then there would be the possibility of sequencing Pirtobrutinib after the progression on the covalent BTK inhibitors. And in fact, some of us are now trying to access Pirtobrutinib off-label in that way, especially for patients who progressed on both BTK inhibitors and venetoclax, because we don't, again, have other options of similar activity readily available.